Hello all, this is Miss Gibson. The next lecture we are doing is immunologic disorders of the kidneys. Here's your objectives. The first thing we're going to talk about is a syndrome called nephrotic syndrome. It's a condition of increased glomerular permeability, allows larger molecules to pass through. There is a massive loss of protein in the urine, edema formation, decreased plasma albumin levels, usually due to altered uh, immunity with inflammation. So, what some interventions would be treating the underlying cause, ACE inhibitors, heparin, some dietary changes, which is where your patient education comes into play, and sodium restriction as well. With your nephrotic syndrome, it begins in the face. Your skin will be pale, then hyperlipidemia. It causes abnormally elevated levels of lipids. Protein in the urine. We know that the protein molecule is too large, so the kidneys generally won't filter that. A lot of vomiting, and then tachycardia. You'll have generalized edema, which is called anasarca. That is the number one indicator of this nephrotic syndrome. Let's see. Well, your hyperlipidemia, this abnormal levels of lipids, when the level of the protein albumin in your body, in your blood, falls, your liver makes more albumin. At the same time, your liver releases more cholesterol and triglycerides. So that's why the hyperlipidemia comes into play. Also, you will have what's called foamy urine, and that's due to the excess protein. Diagnoses, of course, a UA, 24-hour urine test, and then your BUN and creatinine. They will also try to do a kidney biopsy where they'll insert a needle through your skin into the kidney. The kidney tissue is sent to a lab for testing. Management, of course, you're going to do, the doctor may order some diuretics, antihyperlipidemias, antihyperlipidemic, I can't even speak. So, cholesterol medication, anticoagulants. You're going to teach on low sodium diets, high protein diets, staying away from, that excess protein. You're going to monitor your eyes and nose, skin care due to the edema. Next is glomerular nephritis. That's a mouthful. So this is a group of diseases that injure or inflame the glomerulus. What does the glomerulus do? That's what you need to know. So make sure you go back to your anatomy. That very first lecture, the urinary intro, will give you that information. This will allow passage of protein and blood into the urine. There is primary and secondary, and of course acute and chronic. The acute just means that it comes on quickly and it is due to other issues. You want to ask about recent infections, illnesses, surgery, any kind of disease processes that might be going on, any changes in urinary elimination, skin lesions, any signs of edema. Then you have your same labs there. Intervention, of course, you're going to manage the infection, prevent complications, also provide education. Preventing complication if the patient has fluid overload issues. You're going to give the diuretics if they're ordered. You're going to put them on a salt and water restriction per doctor orders. And then you're also going to give antihypertensive drugs, may also be ordered. And then if it is getting worse or it becomes chronic, they will order dialysis. Let's see. Chronic, you're going to ask about the health problems, any exposure to infection. The exact cause is not known with the chronic. The kidney tissue atrophies, nephron functions are reduced. This reduces the glomerular filtration, so the urine's not getting filtered. Proteins enter the urine, and then it always leads to end-stage kidney disease. Always ask about other health problems. You also want to make sure that you're assessing symptomatic circulatory overload problems, like are there crackles in the lungs? Is there neck vein distension? Is there that anasarca where there's generalized edema? Any skin changes? And then, of course, once again, all your different urinary labs. Intervention is prevent complications. You're going to do your good patient education on dietary changes. They will eventually require dialysis and or a kidney transplant, unfortunately. So that's all there is to that one. Short and sweet as always. If I have confused you or misspoken, please do not hesitate to email me. You can set up an appointment to come see me. Once again, make sure you're looking at those resources. I will do my very best to upload as many as I can. Anything that I come across that I feel like might help you guys, I will do my best to put on Blackboard under other resources. Thank you so much.